It's important to have a healthy spine. One way to help to maintain a healthy spine is to work with what's called the Heart Bolster. Making a bolster is important in its details. Take a Mexican blanket, a nice tight weave Mexican blanket, and fold it in half. Then fold one end over as I have done so here. Fold then from the end of the folded edge, roll nice and snug, pushing out any excess fabric all the way until you get to the end. Depending on the amount of tension that you carry in your body, you may want to stop here. But I would suggest, if it's possible to do so, to take it all the way to the end and have a medium to small size bolster here. This I would call a medium to large size bolster. Depending on the tensions that you carry, you're going to have a different opinion about it. But here is the one that we will use as Yarina comes and is the student. Find a space that's about 10 feet in length and 6 to 8 feet in width that's free of objects, and please put all your animals, your pets, into the other room because they'll want to jump on top of you. Placing your yoga mat down into this area, set the bolster 1/3 of your way down from one end of the block of the yoga mat. This is where your head and your upper body will be. Your lower body will be here. This is a 2-blanket rolled bolster. It means I put 2 blankets together and rolled them up as I described in the previous set. Setting a block right here for the head to rest. The upper thoracic, right below the shoulder blades, will be placed right here. And I'll have a student demonstrate this. Sit on the yoga mat in front of the bolster and know that the thoracic spine is in this region of the body and that you want to rest the middle of the bolster right along the lower wingtip of the bottom of the shoulder blade. So when you come back, you set the elbows to the bolster, come back with the elbows, and then position the shoulders to be directly over the center of the elbows and let the elbows go out to the sides. And you will then rest right about in the perfect place of middle thoracic spine, arms rotate open and out to the side and shoulder blades descend. The head should never be higher than the level of the bolster, so a block for this size of bolster is appropriate. But if the bolster is smaller, maybe you want to fold a small pillow or or a blanket or two under the head. You never want the head higher than the thoracic spine. Resting with the arms rotated open, so the shoulder blades are descending here in this fashion. Just breathe into the upper body. Resist sending breath into the belly, but rather ask for the intercostal muscles, those that bind the rib cage together, ask for those muscles to expand. Breathing into the upper torso, ask for the breath to move into the place where you feel the bolster bending the spine backwards. If it's particularly intense, do your best to relax as much as possible. As the arms are out to the side with palms rotated open, I want you to swim the arms back to move the muscle and skin, not bone, but just to stretch open the skin a couple of times with each arm in a nice, easy backstroke action, and then rest the arms to the side. On an exhalation, you want to extend out through the arms with a great deal of extension, as much as you can get, and rotate the thumb side of the palms downwards towards the floor. Looking to maintain the rotation from shoulders to wrists, lift the arms up into the sky and bring the little finger side of the palms to touch. Then rotate just the palms together, keeping the rotation in the arms. Lengthen the arms then overhead, stretching out of the thoracic spine, lengthening out of the shoulders. Do not bend the elbows. Keep the palms pressed together and try to maintain the rotation of arms from shoulders to wrist. Hold for 30 seconds or more, preferably a full minute. Breathe nice and deep, resisting the breath in the belly. On an exhalation, after a minute has passed, lift up the arms a minute or so, out and down to the sides. Then rest completely the shoulders and the arms. Other variations of things that you can do while here are reaching out with the right arm only, straight up and across the front of the body. Give a nice lengthening stretch out through that arm without bending the elbow. The action should be lengthening from the inner elbow joint to the wrist so that the arm stays nice and straight, Then if you want a deeper position, you can take the left hand to pull gently down, but not if you bend at the elbow. Pulling the forearm up to be parallel to the collarbone, pull the shoulder blade down, keep it long, and pull it down this way, depending on how much information you're interested in or willing to get. If the shoulder is hurting, never push through pain. Do not create a place of more injury by pushing through pain. There should be a place where you can breathe into comfortably and feel the stretch and the work being done without being in a great deal of discomfort. Releasing that arm, let it out and down. Lifting out through the left arm with the same action. Straight up and across the body, try to follow the line of the collarbone from shoulder to shoulder. Not bending at the elbow, lengthen through the forearm here and straighten out the elbow joint here and then bring it down as much as you're able to do so. Stretching all the way into the back if you can. Relaxing while doing this, every other body part. Relax the pelvis, relax the legs, soften the knees, the ankles, and always, through most of yoga, relax the face and throat. On an exhalation, after 30 seconds or more, lift the arm up, rest it out, and down to the floor. Taking the two arms out, reach up into the sky and fold in the elbows. Taking the right hand to the left elbow and the left hand to the right elbow, take the forearms to press up into the sky and then internally push apart at the elbow joints and lengthen the arms overhead. Reach through the spinal column. Imagine perhaps or visualize the interior spine lengthening, the chest broadening, and the triceps stretching towards the elbow joints. Simultaneously giving a gentle pull apart so you work deep into the shoulders. After 30 seconds or so, lift up the arms. Change the interlock of hands over the elbows, and then take that position overhead again. Observe differences if there are any, depending on how you carry tension or have issues with the shoulders. One side might be more challenging than the other. Stay as relaxed in face and throat as possible. Relax deeply in the pelvis, the legs, and the feet. Letting the legs rest open, relax deeply. Focus on the energy and breath into the upper body, wherever you feel the issues or the tension. On the exhalation, lift up the arms. Open them out, much like a flower blossoming. Release open, out, and down to the floor. Relax the elbows, shoulders, and all of the body. Going for twists, bend the knees. Take the feet to the right side of the yoga mat. Shift the pelvis to the right side with a turn in the hips, turning the left hip side more down, the right hip side more up. And then descend the two knees down to the left side. Resist lifting the right shoulder off the floor and turn the face towards the right. The idea is to remain as soft and passive in the shoulders, chest, muscles of the face, and throat as possible. To deepen the work, tuck under tailbone, lengthen thighs towards knees, and squeeze knees together while pointing the toes away. The placement of the toes into the arch of the bottom foot helps to create more length into this thigh and keeps the two knees to be more parallel. That will also deepen the stretch. After 30 seconds or more, up to a minute at least, lift upright the knees, come to center, shift the pelvis to center. Observe the spine to be in alignment with the pelvis, and then take the feet to the left. Shift and turn the pelvis to the left. Resist movement in the left shoulder and descend the knees to the right. Again, placement of the toes into the arch of the bottom foot will help to maintain the two knees to be as parallel as possible, and that will deepen the stretch. Breathe into the body wherever you feel the difficulty. Taking the breath into areas of challenge, you should be able to observe the ability to move the tension out of the muscle by expanding the muscle fibers very specifically in the place of the issue. As you inhale, you create space, and as you exhale, you are able to move into and occupy the space that you've just created. So the longer you hold the pose, and observe that process of slow, deep inhalation in and out, creating and moving into space, the more the pose should become comfortable. You should hold the pose for at least 30 seconds, but a minute if you can. On the exhalation, lift upright the knees, come to center, adjust the spine, and relax.